Hi, my friends. Back to you on a Saturday afternoon. Today I decided to repeat the material I spoke last Saturday, but this time in English because I had a lot of requests and I know it's a very interesting topic and that most of us are interested. Okay, so our topic today is going to be coffee, obesity, and diabetes type 2. Actually, if you want more details, there is a paper that I published, a mini review on it at the European Journal of Nutrition. You can find a citation on my LinkedIn and in my ResearchGate websites. Okay, so coffee, obesity, and diabetes. Okay, so what is the link between those three things? Well, first of all, back in the 90s, Harvard Medical School of Public Health started to do a very interesting work, which is to distribute a survey on dietary habits and also making measurements like, following up the weight, circumference of the waist, and normal routine exams. And they do this with these populations it's a big number of people. They are professionals, they are health professionals actually. Some of them are nurses, physicians, and this group of people has been followed for many years, and every 2 years they have to do this survey. And through following this group of people, they were able to see a lot of correlations between diet and propensity to develop some diseases. And one of them was diabetes. And they found a significant difference between the group that drinks coffee regularly compared with the group that didn't drink coffee regularly. And they found that, the people who drink 3, 4, and even more, like up to 6 cups a day, those are much less likely to develop diabetes type 2 than the ones that doesn't drink coffee. So that, of course, opened up for the researchers to start looking to the coffee and see what would be the components in coffee, what would be the bioactive components that could be responsible for this very interesting effect. And while we know now that coffee has bioactive components that has been shown in research with in vivo and in vitro in animals in the cell line studies, that some of those bioactive components of coffee, they have the property to interfere with the carbohydrate and lipidic metabolism and favoring the reestablishment of the normal homeostasis of the glucose in the system, which is the basic problem in diabetes. Diabetes, a person have high levels of glucose, and this is due to two main things. One is because the cells in the pancreas that are responsible of releasing insulin every time the levels of glucose goes high, those cells are defective. They're not responding to the stimulus like they should. And the insulin that is released is not capable to promote the homeostasis on those levels of glucose. So that is not capable anymore to maintain the normal levels of glucose in the blood, which is normally around maximum 110 milligrams per deciliter. So what is the relationship then of coffee, obesity, and diabetes? Well, actually, there is a term that was coined to explain the relationship between diabetes and obesity. And actually the name of the term is diabesity. And the reasons for that, because around 90% of the people who develop diabetes type 2, they are also obese. So there is an intimate relationship between getting on a normal weight and developing diabetes. So what happens with those people who gain extra weight? Well, normally this extra weight is not distributed evenly beneath the derm, which is the normal place. What happens is that this disorder is because the person tends to distribute this excess of fat in the abdomen, the abdominal region, and exactly on the top of the liver and in the muscles. So when the fat starts to increase in the liver and in the muscles, which is not the right place, should be in the beneath the derm, this has an effect that fat starts to be broken down to produce glucose as a source of energy, instead of getting the glucose that comes from the carbohydrates that is in the blood. So that increase on the fat and that flow of the broken down of those lipids, which are the triglycerides, that leads to an imbalance in the glucose. The glucose starts to get really high because the tissues are not getting that glucose from the blood into the tissue, that are utilizing the glucose that comes from burning the fat. And that then leads to also to the insulin to not be able to respond the way it should. So we start to have what we call a tolerant insulin. So a tolerant insulin and a pancreas that doesn't release enough insulin, that determines diabetes. And what coffee have that leads to this positive effect on obesity and also in reducing the risk of diabetes type 2? Well, we can at least cite 4 important mechanisms. One is well known, is through caffeine, because caffeine, as we mentioned last week, has the thermogenic effect, and this thermogenic effect leads to burning calories and consequently also to reduce the weight. Of course, we are talking about the plain coffee, not the coffee with cream and a bunch of sugar and other things that people tend to have in those places like Starbucks and places like that. I'm just saying the plain regular coffee. That coffee does has a property to burn calories, and like we spoke last week. Besides the thermogenic effect of caffeine, which is definitely not the main effect that leads to lose weight, to control weight, and to avoid developing diabetes, definitely are the chlorogenic acids that have been shown in those studies to promote effects that helps not develop diabetes. So I can tell you at least 4 of them very important. 3 in the carbohydrate metabolism and 1 in the lipidic metabolism. 3 in the carbohydrate metabolism will be, first of all, there are some bioactive components in coffee that has been shown to have this positive effect on inhibiting the activity of alpha amylase and alpha glucosidase. Okay, what those enzymes does, Alpha amylase is the major component in the pancreatic juice and also in the saliva that are responsible for breaking down the carbohydrates that comes from our diet. So if you inhibit those enzymes, you are slowing down the digestion of those carbohydrates, and consequently you are reducing the possibility of absorption of that glucose and increasing the levels of glucose in the blood. And that is actually also a mechanism of a drug that is used to treat diabetes, which is known as acarbose. The name in English is, the brand name is Precoz. Another mechanism that is very interesting also is the fact that it has been seen also bioactive components in coffee that are capable to increase the transport of glucose from the blood into the tissues, which is exactly what insulin normally does, and being tolerant and insensitive and in a reduced amount in the diabetic, there's a good effect that will help to control the levels of glucose in the blood. And another interesting mechanism in the carbohydrate metabolism is the fact that some bioactive components in coffee, they are also shown by research in animals and in vitro that they are capable to increase or stimulate the cells in the pancreas to release more insulin in the system, and which is also very popular mechanism in some drugs that are taken to control diabetes. And another interesting mechanism that I would like to cite, of course I'm not going to exhaust all of them, that's why I'm telling you, if you're interested, look for this paper, this mini review on coffee and obesity and diabetes type 2. That has a good summary of all the latest research in this topic. But I want to leave you with this last mechanism, which is in the lipidic metabolism, which is also one of the mechanisms of one of the drugs that are utilized to control the metabolism of lipids, which are the statins. So there are some bioactive components in coffee that are also capable to inhibit the synthesis of cholesterol, which is kind of trying to reestablish a normal metabolism in the lipidic and in the fat. So that is, like I said, some of the mechanisms that we know now that are responsible for the reason why has been shown that so many people that drinks coffee regularly, 3-4 cups a day or more, they are much less likely, I would say 30 to 45% in this range, less likely to develop diabetes type 2 than the group of people that doesn't drink coffee. So I want to leave you with this message, and you know, keep drinking your coffee, and this is one more good thing that your daily cup of coffee gives to you. As you can see on my side here, I have my Christmas tree. So we are getting close to Christmas and the holidays are coming, and I see people very busy out shopping for Christmas and getting ready, and some of them traveling to meet with their families. So I'm thinking I'm probably going to do just one more talk next Saturday, and then I'll stop for the holidays, and I'll come back hopefully with better and more interesting topics for you on the new year, the 2018. So I hope you have enjoyed this talk of today, and see you next Saturday. Bye.